carries.
Okay, next. Coronavirus updates. That's Bruce.
Yeah.
I'll do the Earth Day cleanup. All right, so for that one, I had 2 families reach out. They picked up. I gave them their T-shirts. They love the T-shirts. And you know what I did on social media is now I'm calling them limited edition. Now people want them. See, it's all how you word it. It's all marketing. So at least get rid of these T-shirts now. And then I've got a few kids from school that need what's it called? They need credits for
They need service hours.
Yes, thank you.
Yeah.
So we're going to have more of that too. So our limited edition shirts will be flying out of the box shortly. So that's the update on the Earth Day.
That's good. Hopefully as the weather gets a little better.
Yeah.
We see less and less rain.
Yeah.
People will get out there.
They picked up 5 bags around the high school on Blackstone Street. 5 bags. Huge, big trash bags.
That's crazy. There's so much. Once it's cleaned up, you know, in no time at all, it's right back to where you started.
And that family was on our last meeting, and that's how they found out about the cleanup. And they wanted the limited edition T-shirts.
Oh.
Right?
Yeah. Spread the word.
Trying. Is he on yet? No? All right, let's do a bill. Okay, I'd like to make a motion to approve the betterment bill for 121 Center Street to F.E. Morse Enterprises, Inc. and Shea Tanvir for $16,750.
All right, I second that. All those in favor say aye.
Aye.
Aye, opposed, motion carries.
Is he on yet? No.
No, I need him on here too because I wanted to talk about something. That
What else can you do? Food inspection reports? Robbie's on here.
Yeah, he's on here.
Do we have any food inspection reports?
Can you guys hear me?
Yeah.
Okay. It was giving me the mute button a couple times. I have inspections that I did, but I'm waiting on signatures basically. So the way that I had to do them through DocuSign, I had to do them, send them to them, and then get them email signed, but some of them had to go to like corporate. So I'm waiting on 2 signatures. Unfortunately, COVID-19 new release program they're coming out with the software company that's sending us the iPads and everything. They had a little bit of a delay, so our new deadline to have all of our things up and running is this week.
Can you send him a link again to his email?
You don't get the signatures back in time. I'll just put in the reports into the new software so I can get familiar with it.
We can't hear you, Robbie.
You guys just came back to my computer froze there. Where did you move?
All of it.
Okay. So with the company that we're currently or going to be using for the software inspection, the inspection software came up with a whole COVID-19 checklist that they're implementing. So that took precedence over our setup. So our new deadline is this week. I did do a bunch of inspections, I think right around a dozen, just places I was able to pop by, but where I had to do them through DocuSign, I'm still waiting on signatures for a couple of them. So worst case, if I don't get the signatures by the next meeting, I'll just put them into the new software so I can at least get familiar with it and then have them sign in person on the iPad.
Great. That should make things more simpler, huh?
Definitely.
Did Trisha leave now too? Am I the only one left? I guess we have to adjourn.
I got kicked off. My Wi-Fi sucks.
Is Vinny on yet? No. Oh, gosh.
Why doesn't he just click on that link? I'm going to wring his neck. Bruce, tell him to click on the link.
Somebody call him and just put him on speakerphone.
Yeah, Bruce can do that. Can't he? There's always one.
No, it's Bruce too. You're on mute, Bruce.
Bruce. Oh, there's Vinny. He's on. Vinny, I'm gonna wring your neck. No, now turn your mute off. Vinny, your mute is on. Okay, there you go.
Okay, now I can hear you, see you. Hello
This
there.
is
That's
an
the only
accent.
time. That's the only time anybody's ever going to tell Vinny to shut his mute off.
Right. Yeah, I don't know. Okay,
Oh,
well,
Vinny.
This is an
Whatever.
SNL skit all day long. Saturday Night Live skit right here.
right. Logging all the way out worked it, so that was it. I don't know. So where are we?
We're just about done.
Yeah, right.
We need, no, we did a lot of it. We need the coronavirus update from Bruce next.
Okay.
Okay, so coronavirus updates. As everybody knows, Governor Baker turned around and put an outline together today, getting us prepped and warmed up for his comeback policies here. There wasn't a heck of a lot in it, but obviously he shows he's got his team working on it and some ideas, a couple flow charts. I imagine more information will come through during the course of the week here. In the meantime, I think us as trendsetters should just keep going full steam ahead with what we got, because he seems to follow what we're doing anyhow. But
That is true.
But other than that, I mean, things have, somewhat quieted down. Most of the people are wearing the masks. It's just, the track and trace on some of the people have been difficult on a couple of things here that, we get numbers that they don't necessarily call back, or we get calls from concerned people. We have a couple of cases in our apartment complexes here, so I'm kind of like fending off people as much as I can with the HIPAA rules, but that people are want to know where and why and what are they doing to keep us safe.
Okay, I was doing some stats from 5 May through 11 May, taking Esther's numbers from the morning, and it was trending to be about 18.5%. That's confirmed versus tested. The state is running around 14.8 to 15%. So we're about 2.7% higher. Then when you run the confirmed versus active, you're at 30%. They're not reporting that. And then you're doing active versus recovered, we're at 50%. So we're hovering there. I did this morning's numbers, and we went from 18.5 to 19.4 because we had a couple increases in the case as well as the tested. Our active versus confirmed dropped, well, no, it was 30%. And then the recovered was 48.6. I did death rates. They're basically around anywhere from 1 to, depending on when you do it, from 1 to about 1.5%. So state doesn't report that, but I just thought that especially the tested versus confirmed, we can use that number as we open things up, and hopefully, I want to see how it's trending right now. If I look at 5 May through 12 May, it's on average, it's 18.5, but there are spikes anywhere from a 19.1 or 2 to a 19.4 this morning. But the others were lower than 18 or 18. So, that brings that average back down. This morning's probably raised it to like 18.7, but either way, what I'd like to do is as we open up things, especially where there are more than like where paws and claws is going to be a pretty unique and sheltered situation. As we try to do restaurants, even if they're using internal areas and spacing it more than 6 feet, or if we use outside areas, I'd like to see what happens. I guess Fauci's testimony today was he's nervous about some states have had to back off now, especially those that open beaches and a few other public areas. They're now getting spikes. Some states are not going to do it. I think California is one that said they're not doing it. In any event, I guess we only have one business plan, but I think if we use this, as we move into, especially after Monday, as we move into other things, we'll see how it goes, and we can use that as a gauge. So if we have to, if this thing spikes let's say more than 1 or 2% for more than one day, then we'll have to figure we have a situation. We won't be able to figure out if it's endemic to a certain area. We will never know that because these numbers are not linked to areas. And when I was talking to Esther yesterday, she can confirm this, that I guess when we get these numbers sometimes, especially with the nursing homes, these are residents that are not parked there for 4 or 5 years. They were voting residents within the year, and they got sick or they got rehab, and then they got COVID, so they moved them to a nursing home, or they moved them to a nursing home to rehab, and they ended up getting COVID. So, whatever. And those are our deaths. But right now, I don't know if that's good or bad with other towns or other counties and other towns. I don't know. It is what it is. So I think we can use that as a gauge. So that's all I have to say on, let's say, coronavirus updates. So I don't know if anybody else has anything. Esther, you have anything to add to, I don't know if anybody else listened to any other news?
No, I mean, you were pretty dead on, Vinny. We only had one resident that passed away in the hospital. As I told you last night, the rest were currently in rehab, either due to another illness or due to COVID.
Okay, thanks. So anything else, Bruce, or anybody else?
I mean, I'll check in with my group on Friday and see how we are there. I mean, we've been pretty much level with most of the others. Of course, a lot of them out west, they're only dealing with 5 or 6 cases at a time where their population is way down. But I mean, we've been holding pretty steady.
Yeah, I'd be curious. I think either Medway or Franklin have populations similar, around 16,000. It'd be nice to get some of those numbers. I don't think that's available on our Maven, other towns. I think it's only our.
No,
right.
I usually call in and I talk to them, Vinny.
Yeah, so see if you could do that. It might be nice to have that for later in the week or next week.
I think the Milford Daily is also posting the surrounding towns numbers.
Yeah, okay.
It's usually on the website with the last day of the update. I haven't peeked at that website recently, so I couldn't tell you, but I do know the last time I checked, they were on there.
Okay, thanks, Esther. Okay,
and Vinny, as for like the restaurants and stuff, we're just kind of thinking way ahead.
Okay, fine.
I don't want you to think like we're gonna, that we're trying to pull this together in the next week for restaurants to be open. It's just being proactive,
right,
and them coming to us with a plan, and
right,
us coming up with a plan with them to make sure that when that time comes, that we're definitely doing it as safe as possible.
Yeah, I gathered that this morning at the 10:30 meeting. I was happy the way it went. It sounded really good. There was no, as I thought tonight, we'd have a whole bunch of things that want to open up like tomorrow or next Monday. But, I think it went real well. The ad hoc committee, is doing a good job at, getting proactive for the opening as the state moves us along or we move along. But again, we still have to have those plans in and can, see who's first on the restaurant scenarios. Okay.
Mm-hmm.
So next thing.
Just a question. What do we have in place for if they aren't abiding by it? Is it like a warning system? How is that going to work as we go along? Has that been discussed yet or no?
We, no, we haven't really discussed that too much.
Shouldn't we know
Would you
that?
agree on that, Jim? Did I miss
You're
that?
referring to enforcement of the like social distancing and whatnot of the businesses?
Yeah, once they open, because I mean, we're getting people taking pictures and stuff now.
Yep.
And if
Yeah. It's gonna be a team effort. I mean, this is an enforcement through the Board of Health technically, but I mean, we have an inspection team together consisting of Bruce, Tim McCarty, myself, Mark Poirier, Lee Rolls. You know, we are putting businesses on notice that we'll be periodically inspecting them, but also, you know, if you're getting constant complaints, either Bruce will go down or you know, if he needs help, just like always with the inspectional services, you know, we'll help out.
Are you talking about fines or taking that privilege away, Cal, or?
well, I don't know. I mean, it's one of those things that it's pretty serious. I mean, it's like it's not just trash we're talking about here. We're talking about someone's potential health. So it's one of those, you know, if they're not abiding by it, and we're getting these pictures, which we're getting now from some of these restaurants, and now they, you know what I mean?
Mm-hmm.
I don't know. I just didn't know if there was something.
So I'm not sure if that's something that the committee should come up with, or if that's something that the Board of Health should come up with.
Yeah, I think that would be the Board of Health's job. I think we'd send Bruce out and see if he can, you know, obviously if the picture's shot, it'll be you have a certain time maybe. If someone posts it today and said it was last night or it was yesterday, we'll know when it happened. And maybe we can check with management and see. You know, we're not going to get a picture and get somebody down there immediately. But like the group said, there will be.
We wouldn't need to get somebody down there immediately if we have a picture.
No.
That's proof in itself.
Right.
But I'm just saying, you know, that's going to happen.
Yeah.
We're getting it now.
Yeah, I think we'd have to investigate, and then we'll have to decide whether, you know, there would be a fine or there would be a suspension of privileges. I don't know. We'd have to see what happens, or a warning saying.
I would recommend a three-stage, you know, a warning, a fine, and then you know, the potential shutting them down. You know, 3 strikes you're out type of thing.
Okay.
But I think, you know, the fine and the threat of closing them down ought to wake up anybody who's not really, you know, participating to our liking.
Right. All right. So
Okay.
we should probably we should probably brainstorm on that and start.
Well, the businesses
putting
should have to
something
sign that too, so they know what the precaution. I mean, so they know what the what's the word? The penalty is. I mean,
consequences.
yeah.
Yeah, the
Thank you.
penalties or the repercussions.
Is that
Yeah,
on the
I think-
application? Maybe that should be on the application. So when they sign the application, they know that they got to abide by it, or I don't know. It was brought up to me, so I was asking.
Yeah, I think we like I said, I wanted all the business plans signed, and at that point, their business plan's is going to be signed by them, so they're agreeing to what they're going to do, and then we'll have to say that social distancing will be part of that plan for, I don't know when, for a long time, and that obviously the Board of Health will use a warning, a fine, and a closure. The only other time that closure might happen is if, like I said, if we start getting real spikes, it's just going to be totals in the town. We're not going to know where it came from, but we'll have to figure out where maybe either through like pictures or through complaints, we'll say, well, it must have started down there. I don't know how we're going to do that. It's certainly probably not going to start in a place that's a little closed business, a couple of people, you drop off your animal, or you know, I don't know. Even they're talking barbers and hairdressers, both parties wearing a mask. I think that would eliminate the possibility of contamination. But again, we would never really know once we open a bunch of things if there's a spike as to what to do. I don't know.
Vinny, if I may, I got a question for Esther. The track and trace and testing, Have you heard anything more about if they're going to be stepping that up, and if we're going to be able to get a better feel where a spike might happen, or a pod or a group of people?
The only guidance we got from DPH today was that now if you are exposed to a confirmed case, it is recommended that you go be tested. I've reached out to DPH for additional guidance because they stated in the issued guidance that the Board of Health or their doctor would be issuing a letter. So I did ask for a template, for an example letter, for more guidance on that, but I haven't heard anything back. You know, in regards to the testing sites, there are no new testing sites in this area.
Is Foxborough the closest, or is it Milford Hospital? Do we know?
You know, honestly, I've had a lot of people tell me they have issues with getting tested in Milford Hospital. So I don't know if that's changed, but the Foxborough location is open and gets good results and quick turnaround time, as does the urgent care here in the south end of town.
Okay.
And then, you know, you've got a couple of other hospitals nearby as well that you can have testing. I don't know, maybe Trisha could speak a little bit to if she knows anything about Milford's testing capability.
Yeah, so they are testing, but you have to qualify. You have to be symptomatic, or, you know, a healthcare worker or something that may have been in contact with it. You can go to any of their urgent cares, actually not any, because it's only their Northbridge site now and their Hopkinton site are considered their COVID site. So if you think that you have it, you can go in there, be seen by a provider. And if they think that you need to be tested, they send an order over to the hospital, and then you go to the hospital and get tested.
So maybe a question we can ask them is, if we issue a letter stating that they were exposed and need to be tested, would be if Milford Hospital could do that testing for us, if they had the capability for that, or if they would still just have to wait until they became symptomatic.
Okay, I can ask that.
The other thing too, I did forget about the one at the Pulaski. So if that's a site we can use, that's real close to home and it'll be convenient, I guess.
Yeah, it's definitely a site that we can use. You know, as of right now, they're requiring a doctor's order to go over there and have the testing done.
Okay.
So, but that doesn't necessarily mean that you have to have symptoms to have the testing done. You know, you just need a doctor to say. So we'll have to reach out and also see if they will honor a letter, if we do develop a letter to people to have testing done, see if they'll honor that as well.
I do find it is kind of odd to have the Board of Health say, yeah, you should be tested, or you should be tested.
Well, that was my thought. You know, the other issue with the testing, Trisha, is even if you test negative, you still have to quarantine for 2 weeks.
Right.
So I mean, we're utilizing resources that we're being told are limited to go have these people tested, and regardless of the test outcome, they have to be tested in quarantine for 2 weeks.
Right.
At the least.
And I think if they have symptoms, they should be seen by a provider anyway, because it could be something else that they have.
Correct.
They could have a pneumonia, you know.
Right.
Exactly.
I wouldn't want to make the call and say, yeah, just go over and be tested without someone being looked at by a medical professional.
Right. And that's, again, why I reached out to DPH for additional guidance, because, again, most of my conversation is just over the phone, not even a Zoom capability. So
right.
I'm not 100% comfortable saying, oh, yeah, you should definitely be tested. I do know that the urgent care does rule everything else out. So they're testing for strep and the flu and whatnot. And I assume other facilities are doing the same, except for the specific testing sites.
Yeah. So if you're seen at one of the Milford urgent cares, I think they're doing it with other urgent cares or medical facilities in the area too. I know Tri-River and Uxbridge is one of them. So they're in any of the UMass facilities. So if any of those doctors have patients that have symptoms and want them to be tested, they just send the order over to the hospital, and then they don't have to be seen They just get the tests.
Yeah, and I, my other job is at UMass, and I do know that they are testing very frequently, and even people without symptoms, they are testing if there's a suspicion of being exposed. So they are doing a lot of testing within the UMass system.
Okay, that sounds good. Okay, so we
So I
already
just think I still think it'd be good if people just saw their own primary cares or went to an urgent care and let them make the decision.
Agreed. Unfortunately, what DPH is telling everyone is that it's the Board of Health as well. So ultimately, I'm going to refer people to their primary care providers.
Yeah. So we can all just kind of go with that. If someone calls, I would just suggest that myself.
Exactly, but I don't know what is going to be published. So we may get phone calls saying, well, I was told the Board of Health would give me a letter to be tested. So something we just need to keep in the back of the minds.
Is the Board of Health letter going to be sort of like signed by from a doc, like a DPH doctor, like, Dr. Burrell or some other doctor there that's going to say, we're going to use it like any Board of Health order. It'll have, let's say, documentation. We shouldn't be wasting it, but like I said, if we feel someone's in contact or we have an area where, residents are living and they get exposed, and maybe they know where they got exposed, then there should be sort of testing of that area or that group of people in that area,
Yeah, to my knowledge, Vinny, the letter doesn't exist yet.
Okay.
So that's why I reached out to DPH for guidance in regards to a template. Because as far as I'm aware, per the webinar earlier today, the letter doesn't exist yet.
Okay, so it's coming down the pike. Okay, so I guess that's it for coronavirus updates, unless somebody else has anything else. I guess the next item is review of Paws and Claws business plan, which was included with Laura's minutes and everything else. So I started looking at it a little before. So does everybody have it?
Yeah.
Yep.
Okay, so.
And all the inspections were done on this already, correct?
Yes.
Okay.
So I don't know, it looks pretty good to me. Obviously, if no customers entering, if it's going to take an hour, they can come back, or wait out in the parking lot. But they have, I guess, Bruce had said they have tape marked. So they have a 6-foot zone where the animal's placed, and you come up there with your mask on, you place the animal there, you step back, the person opens the door, takes your animal. At that point, I guess they could tell you how long it'll be. Or you could already set that up by calling them and say, listen, I want to drop my pet off at 9 o'clock. How long you think it'll be? And you get there at 9, and then you know that they said an hour, then you come back at 10 o'clock,
So Vinny, Lisa, I believe that owns Paws and Claws is on here. So if you have, let me see.
Oh, okay. Hi, Lisa.
Yep, she is here. So
Yeah, okay.
if you have any questions, you can certainly ask her, but she spoke at the committee that we have, and she, I feel that they have a great plan in place. So they're only going to allow appointments only. And there's 3, they have 4 beds, but they're only going to use 3 workers. They're only going to allow 3 animals in at a time. Between each animal, they will change their gloves, wipe everything down. The next animal.
Okay. Yeah, so like I said, it looks good to me. They did the inspection. We are, like they said, they already let you know what's going on. I did speak to them a week or so ago. In any event, the plan looks good. So I guess at this point, if everybody's ready, make a motion to approve this plan.
Do we have something to sign? Do we sign off on the
I think once
application?
they approve it, we have. Yeah, we have we were talking about an application approval
Oh,
letter. Do we have that already, Jim, or no?
So there's an application that was provided to you. No, I think what is necessary here is that you're simply making a motion in the affirmative that you agree that this is an organization under essential businesses for the care and custody of animals at this time.
but we wanted to
So-
be sure that we signed it as well as the Board of Selectmen. We definitely wanted both signatures on something.
Hmm.
Okay.
And
We can put one sheet together if you like.
Yeah,
Yeah, we-
just one sheet saying that they've been approved. We've approved them to open up business, and then if the Board of Health and the Board of Selectmen have it, then she can have it. We'll have a copy of it.
Yeah. Yeah, but we still could motion this and then the letter could be
Yeah.
made tomorrow.
Yeah.
We can come down and sign it, or Bruce can
Yeah.
run around. Either
Sure.
way, we can get that done.
Yeah, we don't need to wait. She doesn't need to wait.
Right.
Okay, I'd like to make a motion to approve the opening per the business plan for Paws and Claws, effective what, tomorrow, we're gonna say?
Yes.
After it's signed, okay, it's effective tomorrow, May 13th.
All right, I second that.
All those in favor say aye. Aye.
Aye.
Opposed, abstained, so carried. Okay.
So
Is
Jim,
that-
are you gonna rough that together, or do you want to just come up and, are you coming in tomorrow morning?
Yeah, I have something. I can email it over to you in the morning.
All right, yeah, Laura will be there. We'll put our heads together and see what we can do. Thanks.
Okay.
All right, Lisa, you have any questions?
I do not. I thank you all
Okay.
very much.
Okay, thank you.
You're welcome.
Steve-
Good luck.
If Dan is at the 9 o'clock meeting, maybe he can sign it, and then we can all sign it, and then it'll be a done deal.
Right. Yeah, because like I said, it was a good plan. I guess it's going to say it's the only one now, Jim, that we really have, but whatever. It's well done. So
It's a
like I
start.
said, we'll have a draft letter that will have the Board of Selectmen, the Board of Health signing it, and you'll get a copy of that. We'll retain it, and then you can operate the business, and hopefully no one's going to be like that ice cream place, someone trying to violate the space, but whatever.
Oh, God.
It's only by appointment. We got it. No one's going to be rushing in like ice cream cones, I guess.
Right.
Whatever. I still couldn't believe that, but it's back in the news again today, so whatever.
Oh, wow.
So, anyway, okay. So next order of business
We've
is,
done everything, Vinny, except the complaints update.
okay. So health agent updates, complaints, whatever. Food inspection will be Robbie, right?
We have couple, the typical complaints from the apartment complexes wanting to know who's infected and what the apartments are going to do about it. I have a tenant landlord issue at Oakwoods. I also have another hoarding issue, past issue 6. What the heck was it? 6. Laura, you around there? But which one was it? 6. Oh God, I can't think of the address. We pulled it out, but I looked in the folder and there's complaint after complaint after complaint.
Was that the septic one, Bruce?
No, it's not a septic. It's a
Hoarding.
hoarding issue. And then we had the one septic out at 6.
It's 6 Squire.
That's it, 6 Squire.
Okay.
I don't know if that rings a bell with any of you before, but there's a lot of stuff in the folder when I opened it.
Is it outside hoarding or is it inside?
Inside.
I think that's a repeat. Isn't that a repeat? That sounds
Oh,
very
yeah.
familiar.
Oh yeah, that's the
I was
folder.
gonna say Squire sounds familiar.
Yeah.
There's probably about 7 or 8 complaints in the folder.
And we've had both inside and outside through the years.
Okay. Because we also had North Street where there was a lot outside. That I think got rectified, but it's usually another department going in, either police or fire, and uncovering this, Bruce, or was it somebody who visited the house that complained? How did we get this one?
Well, both Mike Catalano and the former guy before Mike had been out there. Tim McCarty had been out there. I mean, I'll have to make copies and send it to you guys. It's pretty
No,
sad.
I'm guessing, what I
Yeah.
meant to say was, how did this come up again?
An anonymous call.
Okay, fine. Okay, that's fine.
I can tell you more later if you want.
That's fine. No, that's fine. I just was curious if it was another department going in, an emergency, or,
No, it's a person who wishes to be made anonymous.
That's fine. That's fine. Yeah, I think, like you said, Mike Graff and Mike Catalano had been out to that property, so we're gonna have to do something. I guess we're gonna have to draft something up, and they're gonna have to clean it up. Whatever.
It's yeah, I'd like to get over there, possibly with Tim, and get inside the house, because it sounds like it's gotten worse.
Should there be a medical or a fire or a police incident, it'll just come back saying, I can't get in the house. Sometimes they can't rescue a person, especially when it's a medical, not a fire.
Some
You
of
gotta
what
get
I
them
read-
out, and that's the other thing I worry about.
Condemning the house, then.
Is it elderly, Bruce?
I'm sorry?
Is it someone that's elderly?
Well, the guy's not getting any younger.
Well, I didn't know if we need to send in a VNS or.
Yeah, no, same people that were there before. And
Okay. Well, let's see if they'll let you in, and then you can just detail what needs to be cleaned. And obviously, we don't want it to be thrown outside, so it'll have to get a dumpster, and hopefully
I'm
his
gonna,
family.
I'm gonna ask the board to give permission to order a dozen Tyvek suits, so that we have them in the closet, because it sounds like that's definitely warranted in this case.
We should have had those. We bought a lot on the 2001 federal emergency funds. We used to have quite a few downstairs.
Should be in that
Medium,
closet.
large, and extra large. So
Yeah, I didn't see any down there,
we're
but
gonna have to look there.
Yeah, there might be in one of the bins or something.
Yeah, and they were with hoods and booties, so you don't have to. You zip up, and they're coated, so they're gonna be warm, but you're not gonna get anything getting on you. Like the only other property we ever condemned was the one that was on was Sinellis on. He passed away, but it was on Chestnut Street, and that one had food stacked 4 feet up throughout the entire property. So, but anyway,
Yeah.
I'd rather not condemn it. I'd rather get the person to either get help. Sometimes they need a social worker, someone to help them realize that they're living in filth. It can attract ants, termites, rats. Certainly if it's food. If it's clothing, it depends,
But
like I
Vinny,
said,
this sounds like it's an ongoing issue.
it is, yeah. It's been there for Graf passed away in 2004, so, or 8, whatever it was. Either way, this is now, 12 to 15 years it's been like that. So that's quite a long time.
Yeah, it's.
Well, it said even when Mike was there.
Yeah. I think it was 04 Mike was out there, but I'm not sure. We'd have to look at the folder. And then you could look and see when Mike Catalano went out. So it may be the same person just saying, hey, I keep calling you guys and we're not doing anything about it. So that's not a good thing to see. It's going through 3 health agents in 15 years. That's, we need to fix this, Bruce. So
That's that was one of my big things with the trying to put that hoarding task force together, but COVID-19 stuck its ugly head in the way.
yeah,
it's a sad story, because if you're not invited into the home, you're sort of trespassing and stepping on people's rights and stuff. And a lot of times they don't realize they need the help. It's a
nasty disease.
Right.
Yeah, but it's something, and it's more than 1 or 2 disciplines. It's going to require quite a different people's input on it to get them the proper help and care they need.
Okay, so
we did have one other. I was called out to a septic that had been installed in 2018
Yep.
where we had some pipes that had a crest in them, so that they weren't quite getting the effluent out to the septic tank, and then the septic tank to the pump chamber is also an uphill climb. So the pipe on the outlet side of the septic tank is about 90% full before you start to get any full into the pump chamber. So that, ADC Septic was out there and repaired one of the pipes, and then I instructed them to keep going and adjust the pipe between the septic tank and the pump chamber by chipping the tank on the pump chamber and trying to pull the pipe down, so we got some good gravity flow there. It was previous install by Dave Brown. He was called by me to go out and look at it, and he kind of basically said, "It's not my problem," kind of walked away. So I was kind of taken back by that. I don't know if we want to get him to come in and explain his actions to the board or not. But
So they had taken out a betterment loan, the original owners, and it was like a $30,000 system.
oh yeah,
That was
it's
installed.
expensive. Yeah.
That was installed 2 years ago.
Yep.
I'm not sure if they sold the house or if it was a foreclosure, right?
He bought the house just before foreclosure. I did talk to the new owner when I was out
Okay.
there. Like, so they did sell it prior to the foreclosure, but there probably wasn't much in his pocket by the time he walked away.
No, but did he have a Title V done on it?
I'll have to look in the folder.
No, I believe
About that?
I believe it didn't need it because it's within that 2-year window, and there's the certificate of compliance issued by the Board of Health was good for the 2-year period, as long as it was pumped. So that's something,
A lot of the problem was the house was vacant or empty, so they didn't know that the problem was there.
Right.
The family had relocated or something, and the house remained vacant for quite a while.
So is the betterment loan repaid?
You know what? I'll have to look into that.
yeah.
So what
'Cause it was
happened
almost
was
2 years old.
Chris Lanou went down there and he fixed the major problem, but it cost the new homeowners $1,800. And now they have more work that needs to be done. That's like another $1,000 that they have to dish out. But the bottom line is this system is only 2 years old. It shouldn't have failed. And from what Chris Lanou says, and I guess pictures. Do you have the pictures, Bruce, or no?
No, I don't. The septic tank and the pump chamber have 2-foot rises on them, so I could see, when somebody went out to do an inspection, that they may have missed that part of it. But I have a hard time thinking that anybody would miss the line from the house to the tank, having a crest or going uphill.
Yeah. Well, that's the other thing too, is I guess our health agent went out and did the inspection, because that's his job at that point. And it's 19 pallets here. I do recall that property when we put it on the betterment package. I would think the loan's been paid back, and because I don't think you can carry it over. That would be nice if you can, but whatever, I don't think you can. So it didn't last very long. We don't like loans that get, how do I say it? You get the money and then you give it all back. It just doesn't do anything for the town or essentially for the person who has it.
We have
So-
systems in place to avoid that now, though, Vinny, so that shouldn't happen.
Right. But that said, we obviously, I think we should get Dave into one of our meetings.
Absolutely.
And the other thing too is, maybe not between the pump chamber and the tank would the agent catch that, or the inspector. But usually I bring a level when I'm doing everything.
Yeah.
They don't like it, tough.
I
We're not
carry-
here,
I
it
carry
has
a
to be
level and check
completely exposed. I've had one site where the guy was burying the stuff. I said, wait a minute, not gonna happen. Start digging it back out, because, I have to inspect it, because when I sign off, it's okay. As any other agent doing an inspection for the Board of Health, you got to be able to see it. You can't see if it's a 1 inch uphill. But if you put a level on, you can certainly see that easily, you know? And then you just tell them right there, you failed until you fix it, you know? I mean,
Tricks of the trade for us old timers. Don't give away all our secrets.
right, okay, well, whatever. Like I
Anyway,
said,
I think that I think he should come into our meeting. I mean, I haven't seen his name on any plans that have come through. But either way, it's unacceptable. If you took on this big job and 2 years later, a system fails,
Right.
and regardless, it's different, set of hands now. I still think that they should still honor that.
right, he should have fixed it.
I know if I make a mistake, I would be first out there to deal with it. I'm taken back that he just told the guy it wasn't his problem anymore.
Yeah, I just.
Nope. I mean, you can use the old developer added. You got a 1 year warranty. If it fails 1 year, 1 day, well, if you're a good developer and if you're a good person, you'd fix it. First of all, you don't want your name badmouthed. You don't want to go before the board that issues your license and have a problem. It's either you suck it up and you fix it. You made a mistake or one of your workers made a mistake, you need to fix it,
Right.
And in this case, it wasn't how the system was being used. It was the actual way it was installed, correct?
Correct.
Correct.
Okay.
Yeah.
So I agree with that. Maybe Laura can reach out and see if he can come to one of our meetings.
See if you can get him on, Laura, for next Tuesday if you can.
He doesn't have, he's totally computer illiterate. So you'd have to get him to come to the town hall and
If
get
Vinny
into,
can do it, anybody can do it.
Oh,
No,
no,
that's not true.
Took Vinny a while, but he figured it out.
Well, yeah, I had to log, like someone said, log completely out. Why would I have thought of that? My computer was on all day, but it's rare that this happened. But whatever, it is what it is. So
that's it.
I'll
No, but
remember that.
if he has an iPhone or something, we can just text him and he can just click on the link and get connected right away.
We have that. Permitting
tell you what.
doesn't have an email or any computer skills or anything.
He must know somebody, though, that can help him for that few minutes.
Thank you, Laura.
If not, he can come down and talk to Bruce and I. We're both inspectors, so I want to hear him say something. So we'll mask up and we'll see him at the town hall. Whatever. So maybe we could reach out to him, set up a time, and we'll meet him.
I mean, when I was in the trade, if the Board of Health agent calls you and says, "Hey, you got a problem," you go look at it. You don't.
Correct.
I'm still taken back on this.
Yeah, I'm shocked that he did that too, because
I'm not happy, and I'm not sure what.
Right.
I mean,
I wonder, is he still working or is he not really working?
no, he's still working. Actually, he has a younger guy now and a crew that's working on it, but the younger guy is pretty sharp. I don't know if he was around when that was put in. So I mean, he's got newer equipment and a kid that seems to be pretty much on the ball. And I highly doubt that, that he would have let that happen. So
okay.
I don't know, maybe a fine or something.
Yeah, I mean, if he doesn't go down, then we can fine him for the amount of money that we already have something in place anyway.
We do.
We had a similar situation, and Vinny had wanted to put something in place. I think we already have a fine.
Yeah,
system
we
in
did
place.
revisit both for the installers, the engineers. We put in a whole system just to protect people from this stuff happening, So let's look at that. I'm pretty sure we have it in there. The fine's not going to be equal to $1,800 or $2,800, but it would be a fine. Either that, if you don't pay the fine, then
Let me put it
license.
simple for you, Vinny. If we find him and the homeowner files a civil suit and there was a fine issued, I'm sure will make out very well.
Right, that's true. Whatever. I mean, I don't know what he's going to say. I don't know how you talk yourself out of
It's
Two
small
pipes
enough
are
that
going uphill.
it's a small enough claim that he could go through small claims, I believe.
Yeah.
Well,
So
it'd be,
anyway.
I would say it'd be in his best interest to do that, or else, I mean, I wouldn't want to give him another betterment loan if he can't go and correct an issue that was created by them.
Correct. I mean,
What do you think, Cal?
I think we should nail him to the cross.
right. But that said, if you do remember the $7,000 mistake that BIG made, and the board brought him in, and we didn't fine him, we didn't do anything. I think we said we weren't gonna let him install anymore, but I don't know if we did that either.
No, he's still working in town.
Okay, so that said, that was just as bad as this one. He crushed the entire field. Now, the good news is I put in that rule now that we're not going to allow anything less than an H20 wide bore infiltrator. I still don't like infiltrators, but as long as you use the extra heavy duty, and if someone were to drive over it, supposedly you'll be okay. That said, I hope so, because the next person that has to pay money, you know, and by the way, $7,000 to fix this was relatively cheap. The guy did it for cost. Anyway, because he also knows the lady, and that lady, you know, has been around a lot in this town, and I was totally upset, you know, like I said, whatever. So anyway, but so it doesn't happen too often, but we've had a couple of people who are licensed installers not do the right thing. So I don't know, whatever.
We brought somebody in before in Weathersfield.
It was BIG, yes. It was that
I
lady.
don't know if it was. I was thinking about that. I don't know if it was BIG. They came in and they.
No, it was BIG.
No, it was? Okay.
Yeah.
It was Weathersfield, right?
Correct. And it was
Yeah.
the one, I know exactly where it is, up on the hill. It was all sand. They had to make a ramp to go up in the backyard. And they laid in a nice field.
Yeah.
Problem is, he beat out two other contractors from Bellingham, and one of them had to go back and fix it for cost. And it's too bad. She paid over $7,000 into the loan, off the loan. I think it was $22,000. She had to put the $7,000 back in, but some of the other people in town wanted a lot more, and BIG did not want to go fix it. He said it wasn't his fault. So that's the same thing, you know what I mean? I don't know. You know, so I mean, this is 1,800 or 2,800. That was $7,000, and we didn't do anything to the guy. That sort of bothers me. You know, you can't.
Somebody wouldn't let him talk during the meeting, and
Yeah.
I don't remember who it was, but somebody.
Yeah. That said, I didn't hear anybody say. I think I said his permit should be suspended. Whatever, but whatever.
Right, but somebody didn't say that at the meeting.
Okay. Well,
but that's why we have systems in place now. So we're
that's
good
right.
now.
That's fine.
Yeah. Okay. I think that's everything on the agenda.
What about food inspection?
We did that.
We did that. Okay, fine. Okay, we have a bill.
We did that.
Oh, you did the bill?
Yeah.
Okay. Okay.
Very proactive while you were trying to figure out.
Yeah, I know. Techno challenge. I got it.
I'd like to make a motion to adjourn.
All right, I second that.
All those in favor say aye. Aye, opposed, abstained, so carried. We are adjourned.
Good night, everybody.
See you tomorrow morning.
Good night.